So for those of you who don't know me, I'm the Chief Officer of the CCG, and I'm also... Today's really about promoting Dorset's integrated care system. So we've brought together NHS organisations, local authorities, some of the community services that we've got in Dorset, charitable and voluntary service as well, just trying to make those connections and get everybody working together and, as we phrased it, walking in the same direction.
I'm based in London, but I've had the real privilege of spending about the last 18 months as our link person for the South West, and in particular working with Dorset. And it's been really kind of one of the biggest highlights of the work that I do, to come down here and see the fantastic work that all of you in this room are involved in and doing.
We started off with a national overview by Dr. Ned Naylor, who's from NHS England. He was talking about ICSs and the NHS long-term plan and this direction of travel. And then our own Dr. Karen Kirkham was able to give a local flavour to that, and all of the initiatives that have now popped up around Dorset, where we have got the various different people from different organisations all working together and trying to get a better outcome and a better patient experience and a better patient journey.
Of primary care, so they hold the ring around their patients, but there are a number of team members that come around them. So that might be health coaches, care navigators, physiotherapists, first contact physios, pharmacists, paramedics and so on.
But we actually need to turn the system around so that the spend isn't at the top, at the expensive end. The spend is just the little nudges at the lower end that make a real difference to people's health in general. And if we can do that in Dorset, and I genuinely believe we can, then we are going to be a truly successful system. And that's where we need to start from. We need to stop thinking about health, and we need to start thinking about prevention, and prevention at scale.
The reason I'm here today is to be here to drive quality for us across the ICS. It's really important working together with our partners, really hearing that great news that we had from Karen Kirkham this morning about all that great work that we've done, just building on that and making sure that our patients are the centre of our focus, but thinking about the whole patient and not just those data sets.
I'm here because I'm keen to know more about what this means for us at locality level. So the GP practices that I work with are already very committed to working with their partners at local level and integrating care. And I'm keen to know what we can learn from the bigger picture and how we relate to the bigger picture, really.
I think it's just generally coming together, all of us understanding that we're all pulling in the same directions, because I think it requires clinicians, doctors, nurses, therapists, pharmacists, but also managers to help us make this happen. On our own and individually, it won't.
Today I hope that I can go away with a better understanding of our Dorset and how working together not only supports the professionals but the carers and the patients themselves.
We've got people manning various stores, and we're having a walk through sort of gallery of that, and we're letting all of the participants talk to them and see just for themselves some of the things that have gone on in and around Dorset. They're up and running now, so they can talk to them, they can find out a bit more and go away a bit of information and see if they can make use of those sort of facilities and opportunities that already exist in Dorset.
I work for Dorset Workforce Delivery Team, and we're a team that has been set up to work in partnership with local NHS and councils working together. We're here today to explain to individuals the different roles that we all do, from workforce planning, recruitment and retention plan, leadership and talent management, apprenticeships, and the aim of today really for us is to impart some knowledge, get to know people and to ask where we can help them.
I'm here today to actually promote the prevention at scale work that Public Health Dorset is doing across the Dorset County and within the healthcare systems and other local authority systems in Dorset. We have 4 strands to the prevention at scale work, starting well, living well, ageing well and healthy places.
Better Births is a 5-year delivery plan set out by National Health England. Here in Dorset, we're one of an early adopter site, fast-tracking improvements to maternity care in Dorset for women and families across Dorset.
today we really wanted to help promote the opportunities that are available through apprenticeships. The apprenticeship agenda has changed a lot over the last couple of years, and really to promote the staff development for new workforce coming in and for our existing workforce in terms of the opportunities available. In particular, thinking about some of our clinical careers, the nursing associate and the registered nursing degree apprenticeship opportunities.
I'm here from Live Well Dorset, and we are celebrating this week having supported over 20,000 clients to help them lose weight, quit smoking, get active, or drink less alcohol. We are here today to work with partners, to meet with people and share the vision for Live Well, which is pretty big. We've got some big dreams and we're on a mission to really help the whole of Dorset to get healthy. We are recently launching a new part of our website called My Live Well, where people can log on and create their own healthy living profile. We give them tips and tricks on how they can switch unhealthy habits with healthy ones. And they can come back and update their profile at any point to keep track of their journey to healthy living. And that's available for any adult in Dorset, completely free.
I've had a lot of interest today in the stand and the posters we have on the stand. Some of it has been from allied health professionals themselves, but some of it has been from other people who think that they may see the opportunities for allied health professionals within their areas of work. I've had a wonderful opportunity to talk to allied health professionals, and I have gained a much better insight into some of the challenges and the opportunities they are facing within their own organisations. I've learnt from them about areas that I think we need to look at in more detail in the future, and it has been some very valuable and enriching conversations.
So what we do is we support people from different ethnic backgrounds in Dorset, and we support in different ways.
How do we start to better evidence the information that we gather at community level to influence national policies, national government, and maybe linked through to parts like DEFRA and so forth, but it could equally apply to sector in Dorset and the policies that we create here to actually deliver better outcomes for our patients and our population.
I still feel risk-taking should be higher.
So here we're trying to define the successful characteristics of an integrated care system. So we've got huge amounts of energy and vibe in the room, with people talking together, thinking about some of the words, some of the characteristics that they would recognise as being successful and what works for them in terms of the work that they do on an everyday basis.
A couple of things. One was looking at, rather than having individual professions, having those professions but working in a more practitioner way. So
I just want to make sure that everybody comes here today, walks away understanding what the integrated care system is about, trying to get some personal commitments that they'll help us on that journey, and just continue some of the enthusiasm that we've seen from our early speakers, that everyone can go away thinking, actually, we're on the right journey this, we can do it in Dorset, and we can make it a better place to live and be cared for all of our population.